Many Colorado hospitals say they have been treading water to keep afloat for patients, and now they want the state legislature to help.
Fox 21's Jessica Livingstone explains why $1 billion state budget deficit might make that easier said than done.
We have seen our costs and expenses grow far faster than our revenues for several years now. We've seen expenses in labor and equipment rising at double digits, approaching, 30, 40, 50% cost increases over those few years.
Funding for all 110 Colorado hospitals could be at risk of getting cut this year, as state lawmakers are looking to close a $1 million budget shortfall, which could be a problem for hospitals trying to break even.
70% of Colorado hospitals that have a thin or a negative margin.
Hospitals are already seeing impacts with the recent closure of Arkansas Valley's Regional Medical Center's OB department in La Junta.
Those trends will only get worse if we continue to cut short our hospitals and our healthcare providers.
With legislators looking at ways to cut health care in the budget this year, Timon's concerned for those on Medicare or Medicaid, this shortfall could make it harder for those people to access health care.
The percentage of revenues that hospitals receive from public payers, which is Medicare and Medicaid, is over 60%.
For those on federal funded insurance, patients already tend to.
Patients show up sicker than they would have been before. They show up sick because they neglected or postponed care during the pandemic, or because they lost coverage and felt like they couldn't afford to go see the doctor.
The Colorado Hospitals Association's main concern is their patients and the care they receive.
It looks daunting, and so again, we just urge lawmakers to exercise extreme caution at this uncertain and delicate time.
In Colorado Springs, Jessica Livingstone, Fox 21 News.